people make so much of, previous infectious disease or the potential of having an underlying autoimmune disease and say, the vaccine's not for me. But, clearly, what you're talking about here, and that does not seem the case. So that being said, Sherry, back to you. Does hearing this change anything for you in your mind?
I don't think I can make a change like that. I think it would be something that I need to speak with my physicians about, who are specifically familiar with my condition and my issues with bleeding and clotting and my, the antiphospholipid antibodies that I deal with on a daily basis, and the medication that they do or don't give me and how that affects me. It's a very risky decision. I'm surviving on dialysis at this point very healthily. I'm an extremely healthy dialysis patient, which is a wonderful thing. And I'm enjoying my family now, doing very well. If I end up getting the vaccine and it makes me very sick, then I don't know if I'm in a better circumstance or worse. At this point, I'm scared, nervous. I need recommendations from the physicians who are most familiar with my condition. And I think, I'm not ruling it out. But at this time, fear is still huge for me, and that anxiety.
Hear you, Sherry. And you're such a great advocate and quarterback for your health. You are on top of it, and I'm sure you will have a very thorough and healthy discussion with both transplant team and your other treating doctors for your other issues. Back to you, Dr. Spellberg. What's your advice to people who, in general, who want to have non-judgmental conversations with their doctor about vaccine concerns?
Well, obviously, it can be very frustrating for those of us who are caring for patients, including dialysis patients in our ICUs with COVID, and not understanding why people have not gotten vaccinated when they're at the most vulnerable. You ask questions, and we do our best to provide information. In fact, there have been studies of patients with autoimmune disease, including lupus, and those patients get antiphospholipid syndrome, and those patients did not have an increased risk of adverse events from the vaccine. So there are data to answer these questions. The data is out there. And, it's vaccine hesitancy that's very difficult to overcome. We just have to keep providing the information.
Well, Sherry, a lot of information we shared with you and our viewers in general. We wish you all the best. We know that you are smart and a great advocate for yourself. You're going to do your homework, and you will make the right decision. Thanks for coming. And Brad, Dr. Spellberg, always a pleasure to have you on the show. Thank you so much for your insight.
Good to see you, Dr. Orton.